Yeah, so Paul Hamill, the World Herald, is asking, okay, so been about a month since we put these restrictions in place. I made a comment at some point, we'll know more after a month, and after a month, what more do we know? Well, I think the first thing we know is that we need to do more testing, and we're working on getting that capacity. We have not stressed the system out from the standpoint of PPE, though that remains a constant concern that we continue to bring personal protective equipment in and get it distributed out to our healthcare workers, law enforcement, nursing homes, so forth. And that the plans we have put in place have not overwhelmed the healthcare system, and that the non-pharmaceutical interventions that Dr. Antone was mentioning, they're working. That we have slowed out this process. We spread it out, we've taken the curve down. Now, part of why we know that is because we're looking at some of the models that are out there, and so, again, those are just models, just help us to think about it. But again, we know that ultimately the goal, which is not to overwhelm the healthcare system, has been achieved so far. That even where we've got a hotspot like Grand Island, as Dr. Antone was saying, St. Francis feels like, even though they're working really hard and they've had to open up new beds, that they've got it under control. And again, assisted by the hospitals in their system, but as Dr. Antone said, every hospital in Nebraska has stepped up to say, hey, we will take patients, we will be a part of the team.
What do you know about restrictions, though? Some people say, let's drop them right now, and other people are saying, we're going to be dealing with this next year.
Yeah, I think, again, the question was, well, what about restrictions? How do we know they're actually working? Or maybe this was, just as some people thought, maybe a hoax. This is real. And I think what you see is that when you have success, it doesn't seem like we're being impacted like states like New York, so people maybe question, was it a real thing? That's kind of an indication of success, that we can see in our country states like New York where they have been severely impacted by this because they were not able to take those interventions early enough. We here in Nebraska were able to take those interventions early enough and did not see the same sort of impact as states like New York. So I think that that's an indication that what we're doing is working, that we didn't have our healthcare system overwhelmed the way a state like New York did. So because we moved earlier relative to when we had the virus here in our state, we were able to have schools start operating without students, do the physical distancing, that 6 foot, reduce the size of crowds to 10 people. All those sort of things really slowed the spread of virus here in our state.
Does that change your thinking about when the peak will be?
Does it change the thinking about when the peak will be? Well, again, you look at the models, you think about it, does it mean it might have been pushed out? Potentially, but it also means that we're able to handle it even as we see the number of cases continue to go up, and we got to continue to watch that trend, to see, how fast cases are going up. But again, we're still collecting data on a lot of this stuff, but I would say the things we've done here in Nebraska, we can say from the evidence of how many people we're testing and how many fatalities we've had and how many ventilators we're using, all that what we're doing is working.